Hi, welcome everybody. I'm going to give it another second or two for everybody to connect. We've got a couple of folks that are not able to join us today, so no fear. I'm recording this meeting today, so we'll be able to send it out to you to watch again if you'd like. So hi there, everybody. I'm Shan Hogue with Lumen Insurance, and today we're going to talk about those slick talking ads you see on TV about Medicare Advantage. I'm going to go ahead and dive right in here. So in order to really give you a full picture of what's happening, I really want to go back and teach you kind of some of the basics of Medicare so that you really understand the differences between the Medicare Supplement plan you have today and the Medicare Advantage plans that you're seeing advertised everywhere. And we're going to talk really specifically about the pros and cons for each one of those types of plans. And then at the very end, we're going to talk more specifically about the Medicare Advantage plan and just kind of review reasons you would want to go with it or not, and kind of what some of those pitfalls are. They're not perfect plans, but I will say I really think that they are great plans. They're just not meant for everybody. So today is really about figuring out if those plans are right for you. And then finally, if you're interested in scheduling a personal appointment with me to look at your specific situation to see if you want to switch over to a Medicare Advantage plan, at the end of this meeting, you'll be able to see how to do that. And then also, when I follow up this meeting with an email, you'll have a link in that email to schedule a personal appointment with me as well. So I just want to make sure that everybody understands that I'm just doing some basic education. I am not recommending any particular plan over another. We are not going to be showing any specific plan materials. We're not signing anybody up on a plan today. Really, we're just trying to get you educated on what those advertisements are talking about when you see them. So I have everybody on mute today. If you have a question while I'm talking, please put it in the chat box. And if you could do me a favor and go into the chat box right now, if you could find that, and tell me the city and the state that you are calling in from today. Thank you, Angela. Awesome. Welcome. I do have clients that are in Nevada and Arizona, as well as Idaho, Texas, in addition to California. So every Medicare Advantage plan is different based on the county that you live in. So telling me what county you're from really helps me to understand where you're at. And it also lets me know that you know how to use the chat box. So if all else fails, if you could just wave frantically in the front if you need to ask me a question and you can't figure out the chat box, that works too, because I can unmute you to ask your question. All right. Okay, so let's go ahead and dive right in. So original Medicare, if you remember, is that red, white, and blue card that you carry with you, right? It's comprised of Part A and Part B of Medicare. Now, A is your hospital insurance, and B is basically everything that's done outside of a hospital, right? All your medical, all your doctor's appointments, labs, x-ray, hospital, emergency room, surgery, chemotherapy, radiation, all that stuff is all underneath Part B. And I want you to think of Part A as really a bucket of money that Medicare is pulling from to pay for those claims, right? These are two separate buckets of money that they're utilizing to pay your claims. And if you didn't hear, your Medicare Part B premium is going down next year, and it's only going to cost you $164.90. So this year in 2022, you're paying $170.10, and starting in January of 2023, that's going to go to $164.90. So excellent news, because I also hear you're going to get a cost of living increase. So it means, like in previous years where your Medicare went up about the same amount as your cost of living increase, and so it was a net increase, I think this next year you're actually going to get a raise, right? I don't know how much that's really going to equate to, but it's better than having to pay more. All right, so Part A and B together, they comprise and make up about 80% of all of your hospital costs. That means when you go in for a hospital stay, you're going to have a big deductible, and then the rest of your hospital stay will be covered by Medicare. When you have any other sort of Part B claim, you have a small deductible, right? This year it's $233. Next year it's also going down to $226. And then after the deductible is met, you are responsible for 20% to infinity. Okay. Your old plan that you had when you were working, right? Or some of you are stay-at-home moms, whatever you did, right? But whatever plan you had prior to Medicare had some sort of a stop to it. It's called an out-of-pocket maximum. Medicare doesn't have that, right? So that's why it's so important for you to get something else to cover the 20% that Medicare does not. Because if you get some large claim, like, I don't know, let's say you get cancer and you have to go in for chemo and radiation, then unfortunately you're responsible for that 20% to infinity until basically you're dead broke. Nobody helps you with that, right? So if you get $100,000 medical bill, then you're going to be responsible for $20,000 of that, right? So this is, again, why getting something in addition to original Medicare is so important. Now, there are two types of plans that you can get when you are on original Medicare. One of them is called a Medicare Supplement. You'll also hear this called a Medigap plan. You'll hear it called a secondary plan. And you'll hear it called a Medicare Supplement, right? These are all interchangeable words. So if you hear them, know that they are all referring to option one. The other option is a Medicare Advantage Plan. These are those fancy plans you're hearing being advertised on TV, the ones you're getting mailers about, the ones the telemarketers are calling you about, right? Now, this is Part C. Technically, it's Part C. So if you ever hear it called Part C, a Medicare Advantage Plan is what they're talking about. Now, when you go with a Medicare Advantage Plan, it typically, but not always, but typically contains a Part D plan. When you go with a Medicare Supplement, you have to buy a separate Part D plan. Okay? All right, let's talk about option one first, and then we'll talk more about the Medicare Advantage Plan. Now, the Medicare Supplement policies, these are standardized plans. They're offered by lots of different insurance companies. Mutual of Omaha, AARP, Blue Shield, Anthem Blue Cross, HealthNet, Cigna, Aetna, like, oh my gosh, there's so many different carriers. No matter who the carrier is, they have to follow Medicare's rules and guidelines. And every one of the plans that they offer have to follow their standardized plan concept. Okay. And these standard plans are named for the letters of the alphabet. They are Plan A, Plan B, Plan C, Plan D, not to be confused with the parts of Medicare, Part A, Part B, Part C, Part D. These plans of Medicare are different while still named A, B, C, D, etc., right? The most popular plans these days are the Plan G, and some of you on the line may have what's called a Plan F. There's also a Plan K, there's a Plan N, right? Lots of different plans. Whatever plan you pick, it is the same no matter what carrier you buy it from, okay? So however the benefits are set up under the plan, no matter who the carrier is, they all have to be identical, okay? Because they're standardized. Now, these plans are going to cost you, right, a monthly premium. In addition to the premium you pay here for Part B, you're going to pay a monthly premium on your Medicare Supplement plan. And it averages, for somebody fairly new to Medicare, in the first couple of years they get on Medicare, it's about $150. But I see plans that you can get for as low as $50, as high as $300, right? Depending upon the plan you get, depending upon your age. These plans are all going to increase in price. Those of you that are on a Medicare Supplement plan know this for a fact, right? Every year it creeps up in price on you. These plans, though, they allow you to see any doctor anywhere in the United States. There is no network. Now, a lot of people think that this is a PPO plan. It's not. Technically, it's not. Because PPO says these are the doctors you can go to and you'll pay this dollar amount. You can go to anybody outside the PPO network and we'll still cover a little bit of your bill. That's what PPO means. This is not a PPO. This is a Medicare supplement. You just have to make sure that the doctor you want to see will accept Medicare, is contracted with Medicare, and will take you on as a new patient. Okay? So tons of flexibility. You may travel the United States. These plans work really well for somebody who wants to spend 4, 5, 6 months in another county or another state. Let's say you have another home, a second home somewhere, and you don't want to have to come back to your home county in order to see a doctor, right? If you have a second home on the coast, or you have a second home in Montana or Arizona, you want to be able to go see an eye doctor there, or a cardiologist, or maybe it's time for your annual exam, or maybe you found a lump and you want to go in for a mammogram, right? And you're not planning on being in the other space, right, for a few months. That's where this plan really comes in handy. Now, when you first got onto your Medicare Supplement plan, it was probably because you were first enrolling in Medicare and you got in guaranteed issue and you did not have to answer any health questions. Well, folks, this plan is the last type of plan for health insurance left in America that can ask you health questions and deny you for health reasons. Now that you're on the plan, you don't ever have to answer health questions again. And they can't deny you coverage based on your health conditions. But if you're thinking about leaving for a Medicare Advantage plan, know that if you ever want to come back, you have to be able to answer all their health questions. And if they don't like what they see, then you're not going to be able to get it back. So I want you to keep that in mind, because that's an important distinction in deciding factor, maybe, if you want to go back and forth. It can happen, and we'll talk more about those instances later, but it's few and far between, and it's tricky. Some of these policies are getting really innovative, and they are offering more benefits than ever. And I'm only seeing this really in California. I'm not seeing it in any other states, but they're adding on specialty benefits, things that original Medicare just does not cover. on a normal basis. They're throwing in extras like vision and hearing and chiropractor, acupuncture, personal emergency response systems, and over-the-counter items. So they're giving you an allotment of over-the-counter items that you can buy at a drugstore or from a specialty website or a catalog even. All right, you do have to get a prescription drug plan, or I should say Medicare wants you to get a prescription drug plan. And if you don't, they will fine you when you finally pick up a prescription drug plan if you ever go for a time without prescription drugs. And this also carries another monthly premium, right? I've seen premiums as low as $4 a month, and I've seen premiums as high as $172 a month. Honestly, it depends on the medicines you're on, and most people can get away with a prescription drug plan that's about $20 to $30 a month. Actually, most of my clients are on a $10 a month plan, so they're fairly affordable, but once in a while you have folks that have a really expensive medicines and it's not on very many formulary lists, so you have to buy a more expensive plan to get a broader formulary list. Prescription drug plans are typically going to steer you to a preferred pharmacy, and they're going to charge you more if you go to a standard pharmacy. That's actually holds true also if you were to be on a Medicare Advantage plan. You have a copay per prescription typically, or a co-insurance, which is basically a fancy word for a percentage of the retail value is what you would have to pay. Each prescription is going to have some sort of copay when you go pick it up at the pharmacy. And then always on a Part D plan, you have what's called a true out-of-pocket expense, but this is different from your medical out-of-pocket expense. This is the dollar amount that Medicare will cap you out at. So Medicare actually has a maximum amount in retail value, not the prescription copay or co-insurance that you pay, but retail value of your drugs. You can only spend so much, and that number's $4,660. That's a big number when you think about it. Let me do the math because I'm terrible with math in my head. $388 a month or more in retail value and prescriptions. That's where you're going to hit your max at the end of the year. So if your retail value of medicines is any higher than that, then you can expect to hit the donut hole or the gap before the end of the year. But those are few and far between. If you're not real familiar with that term, you're probably not hitting it today, and I wouldn't worry too much about it. Now, your prescription drug plan needs to be changed if you're going to change during the annual election period, and that is always October 15th to December 7th. Always, always, okay? If you like your plan and you want to stay on it, there's nothing you need to do, right? You just keep paying your bill, doing the same thing you have been. Your supplement, on the other hand, that gets changed during your birthday month. So remember we said you can't really change supplements without having to answer health questions. We can actually change your Medicare supplement to another carrier to get a lower price anytime during the year if you can answer health questions. But if you cannot, California and Nevada have a rule that says within 60 days of your birthday, you may switch plans to any other carrier to get the exact same plan without having to answer any health questions. You just do the paperwork and you move right over to get a lower price. Okay. All right. When you are on a Medicare supplement policy, you carry a card, you carry your original Medicare card, and you pay a premium here. You carry a Medicare supplement card and you have a premium here, and you carry a prescription drug card and you have a premium here. When you go to the pharmacy, you just show your prescription drug plan. But when you go to the doctor, you're going to show your original Medicare and your supplement card. But your doctor first bills original Medicare. Okay, they're the ones that get the bills first because they are your primary insurance. Now, original Medicare is actually in the business of evaluating and paying claims. So they're going to open up your claim and they're going to follow their guidelines. Is this medically necessary? Is this what we normally pay for? Is this in our guidelines? And if so, then they write out their check for their 80%, and then they send the rest of the bill over to your supplement. And your supplement does not care what your claim is at all. They just make sure that original Medicare paid first because they are called a secondary plan and they only pay second. And they just look at the schedule of benefits according to the plan that you're on, and they write out their check and go on their merry way. And if you have the F plan, they write out the entire check. They pay for everything. If you have the G plan, remember you have to meet your deductible first and then they pay everything. If you're on any other plan, then it's just going to follow the schedule of benefits for the plan that you're on. Okay. That works very differently when you're on a Medicare Advantage plan, okay? These Medicare Advantage plans, they are what we term an HMO, which means you have a list of doctors that you can go see. You have to go see your primary that's in that list of doctors first, and your primary then refers you to a specialist within that list, okay? PPO says, here's the list of doctors you can go to, and this is how much it will cost you to go to one of these doctors. You don't have to have a primary. You can self-refer to anybody so long as they're in this list, and this is the dollar amount that you have to pay. But if you want to go outside the list, you can still do that too. You're going to pay a little bit more to go outside the list, okay? A point of service plan says you have a list of doctors that you can go to for a set dollar amount, and you can go anybody else outside of that whenever you want, and you'll pay a little bit more. But you still have to pick a primary care provider, and if you stay in this little circle, you'll pay a smaller copay than if you go outside here, okay? That's how those work. Now, when you pick a Medicare Advantage plan, they are typically a 0 monthly premium or a very low monthly premium. And you might be asking yourself, how do they do that for 0, right? Does that set up red flags for anybody about how it's 0? Well, notice I didn't say free, because it's not free. They are essentially outsourcing all of the paying of claims to whoever your HMO, point of service, PPO plan is of Medicare Advantage. And as you know, when we outsource services, you pay for that outsourcing, and Medicare then is essentially paying them to pay all the claims. So here it is. They're not paying them a per claim amount. They're paying them a giant lump sum dollar amount to take care of you all year long, okay? And they tell them, make good use of that money because we're done. That's all you get. So they're managing your healthcare to a certain extent, right? They're still following all the guidelines that Medicare has. So you still have all the original Medicare guidelines. You still have all your benefits of original Medicare. They have to give you at minimum what original Medicare gives you, but so many of them give them more. So let's think about this for a minute from an insurance company's perspective. If you're the insurance company and you're getting paid a bunch of money to take care of Beth all year long. Well, Beth, we want you healthy. So we're going to charge you nothing to go to your doctor. And we're going to charge you nothing for your lab tests. And we're going to charge you nothing for all your preventive exams because we want you to come in early to figure out what's wrong with you. Because when you come in early for a medical problem, you are way cheaper to take care of. When you come to us because you had a heart attack, and you haven't been checking your cholesterol, or you haven't been keeping your diabetes in check, now they have a giant hospital bill to pay. And now they have home health or skilled nursing. Now they have big bills to pay for, right? If they can mitigate those costs by giving you very low doctor copays, very low x-rays, and tons of extras, then they can keep you healthy and they get to keep that giant pot of money that Medicare gives them per person. Now, they're not going to, knock it out of the ballpark with every single person, right? The majority of you are going to be pretty healthy, and they already know, statistically speaking, it's going to be a small percentage that they're going to have to pay large claims for. If they just encourage you to come in for all your preventive exams, your annual exams, your little stuff, right? If it's $0 to go see a doctor for it, why wouldn't you go, right? It doesn't cost you anything, right? So you may as well go. They don't ask any health questions to get into these plans. So you could be actively in chemo and switch from your Medicare Supplement to a Medicare Advantage plan. Many of these plans include prescription drugs all bundled up into it. They have varying degrees of copays on hospitalization or if you need a surgery, etc. And they have what's called a maximum out of pocket. So even though you see copays for some of these, every time you go in and you're charged a copay, right, that's going to add up during the year. And when you hit that maximum, you stop paying and the insurance company pays everything 100%. Okay, so the lower that maximum amount is, the better off you are. Plus, they have tons of extras on these plans. Think about it again from an insurance company's perspective. If you're going in for your dental cleanings twice a year because they're offering you free dental cleanings, did you know that a lot of dentists can catch heart disease in a dental office? They can catch your heart disease. They can catch your diabetes. This is like an early signal warning to the insurance company that you need to go in and get checked, and your dentist then can refer you back to your doctor and tell you, hey, you have some diabetes, heart issues, or blood sugar issues you need to get checked on. So they're offering dental. Vision's the same way, right? They can catch disease early by getting your eyes checked. So they're adding in all of these things. Hearing, they're adding in transportation. Well, if a car or access to a vehicle or rides to your doctor's appointment is a barrier to care, they're now solving that. They're doing Part B buybacks. In other words, they're going to give you money back in your Social Security check to enroll in their plan. Those are not without drawbacks. We'll talk more about that in a little bit. Some of them offer you meals, right? Think about a single guy. Doesn't really cook, bad eating habits, doesn't want to go to the grocery store very often, right? Maybe providing him nutritious frozen meals are a way to get his health improved so that he's not so much of a liability for them. right? I'm always thinking about how are they making money? My dad always taught me long ago, follow the money, right? To figure out why people do the things they do. This is why these insurance companies are offering all these extras. They do personal emergency response systems for people who are fall risk. They automatically detect when you fall and they call an ambulance for them automatically. They pay for that monthly monitoring. That's like a $40 monthly monitoring. They offer chiropractic. They offer acupuncture. They offer a gym membership, right? You'll get a free Silver Sneakers gym membership with it. They offer pest control. Think about disease that can come with pests, right? So they're eliminating that. They offer what's called a flex card. These flex cards are actually, I want you to think like a gift card that's loaded up with cash. They'll load it up with money if you go in for your annual exam, when you go in for your mammogram, when you go in for your colorectal cancer screening, when you go in for your flu shot, your pneumonia shot, your COVID shot, right? All those things are stuff that they'll load money on that card for you. Like in a given year, you could have $150 loaded up on a MasterCard gift card. You can go out to dinner on it. You can pay bills with it. Anywhere MasterCard is accepted, you can typically use those flex cards. A lot of time they're offering in-home care. We've got a carrier that's offering 20 hours a year, not a ton of time, right? But think about it. If you had 2 hours a month for somebody to come in and help you make beds, right? No one likes to put the sheets on all by themselves. If you just had an extra hand to help you make the beds or fill your pill packs, right, for the week, or help you with some grocery shopping or whatever it is, right? They even have robo pets, which this is kind of hysterical at first blush, but what they're finding, especially during COVID, is that loneliness, isolation, and depression presents very real medical issues. And they're really hoping to combat some of those medical issues that can come with loneliness and depression by providing you with a robotic pet. So I want you to think Tamagotchi mixed with your Roomba, okay? So they want attention, they're soft and furry to pet, you can talk to them and they can respond back to you, but they don't require feeding, they don't require shots, right? This is an interesting one. I haven't seen any in California, but I am seeing this in Arizona. And then lastly, we've got a new carrier, not a new carrier, but a carrier that's offering green fees. So if you're a golfer and you like to golf, they're going to give you $50 a month to go golfing, right? If you're out there hitting a ball once a week, I think that's awesome. I talked to one of my longtime clients yesterday. He's going to be 83 in another month, and he golfs every single Friday. He does 18 holes. So anyway, I think these are some of these extras. While you look at it from the insurance company's perspective, it's definitely them trying to spend a little to save a lot, if that makes sense. But I think it's also a very much a win-win-win scenario. Now, if there's any drawbacks to these plans at all, it's that you do have to pick a physician group and you have to stay within your list of doctors, okay? You have to pick a primary care provider as well. And these plans are all county specific. So I have people from San Luis Obispo County on the line, some from Fresno County on the line. I have clients out of Texas, out of Nevada, out of Arizona, and Idaho. So wherever you live, just know that the plans are different, all based on county. right? So we could be, this is one of the reasons why I'm not getting into specifics on this call, is because it's going to be different for everybody, just depending upon what county you live in. All right, let's talk about some of the trade-offs that some of these plans provide you. Now, you heard about the Part B give back that they're offering, and you're probably hearing a lot of them on TV. These give back plans are few and far between. So far, the plans that I'm seeing that give money back into your Social Security check, most of these plans are for veterans. So if you're a veteran on the line, this might be something you want to take a look at. But what I'm seeing is higher out-of-pocket costs, higher copays for doctor visits, higher copays for hospitalization, and a higher overall max out-of-pocket. For some of these plans that have a really low out-of-pocket, so I have some really great plans that charge you only $999 a month. I'm sorry, $999 a year. And monthly, when you stop and think about that, that's $83. If you're on the line and you're on a Medicare supplement policy, I guarantee you, you're paying more than $83 a month. And you may never, ever go to the doctor all year long, right? Or seldom go to the doctor, but you're paying probably double that just for your medical plan, and you have a prescription drug plan, right? These Medicare Advantage plans are a 0 monthly premium, and you pay when and if you go to the doctor. So even with a some sort of a huge medical claim, like you get cancer, the maximum you would pay, right, is a certain dollar amount, $999, $1,500, $2,200, $2,700, whatever they are, right? Some of these plans have $5,000 out-of-pocket maximums, right? So the higher they are, usually they have really low copays, right? So it's going to take you a while to get there, but still it's nickel and diming you to death. Some of these plans with a really low copay, they typically have a really high ambulance and a really high hospitalization. So one ambulance ride and one hospitalization could get you to whatever your max is. Okay. These plans are imperfect. You're never going to get perfect benefits all the way around. It's going to be a give and take. Okay. But the plans that look really, the plans that are super imperfect have high out-of-pocket maximums and high copays. They typically have lots of extras. Okay. And really, right, it's that give and take. Some of these plans, when you look at them, almost all of their copays are 0, 0, 0 all the way down the list. But the list of doctors you have to go to is really tiny, right? Which is going to mean you're going to have to switch doctors. And moving back to a Medicare supplement policy is a super tricky process. So I will tell you that there is a rule that says the first time you move to a Medicare Advantage plan, you have 12 months to decide if you like it. And if you decide you don't like it in the first year, you can go back to a Medicare supplement plan and you don't have to answer any health questions at all. It's a guaranteed issue reason to go back to a Medicare supplement. But once you're on these Medicare Advantage plans, you are locked in for the year. There is no getting out of them in the middle of the year if you decide you don't like it. You have to see it through the end of the year, and then the following open enrollment will do paperwork to switch you back to Medicare supplement. But you don't ever switch back until January 1st, even though we're doing the paperwork in the fall. Okay. There's also another rule that says you can move back within 24 months or 2 years. That one's a little trickier to move you back. It has some caveats to it and timing issues. And then there is a rule that every year, if your Medicare Advantage plan changes one of its 5 essential benefits by more than 5%, then you can move to that same Medicare Advantage plans, basically a sister Medicare Supplement policy at no cost, so no questions asked. Not all Medicare Advantage plans, though, have a Medicare Supplement. So that becomes a little bit of an issue, may not be available to you. There's another rule that says if your 5 essential benefits on your Medicare Advantage plan changes by 15% or more, then you have a guaranteed issue reason to switch to any carrier, any med sup, no questions asked. Okay. There have been years where I have not been able to do that because these Medicare Advantage plans, they do change from year to year. So every January 1st, the plan's going to morph just a little bit. You might get a little higher doctor visit. You might have your ambulance ride go up some. They might take away your transportation benefits. They might cut back on your vision benefits, right? So they're always going to change a little bit. Now, what I do for all of my clients is I call them or invite them to a Zoom meeting like this, where we go over all the benefits, where you're going to see what does my plan look like this year? What's it going to change to next year? And let's talk about whether or not those changes are okay. Let's talk about what my experience has been in the plan this last year and whether or not my medical conditions have changed where we might want to switch to a different carrier on the market, right? That I help all my clients do all of that because there's like 25 different plans on the market this year. So, I mean, there's a lot to go through. Some of them you may not qualify for. Some of them are only for people who have a qualifying chronic disease like diabetes or heart failure, right? Some of them are only for people who are low income, who qualify for a low income subsidy, who qualify for Medicaid in addition to Medicare. All right, so there's lots of caveats, right, to figuring out which plan is best for you. So with all of that said, I'm going to go ahead and let's talk for just a minute about when I think that this plan would work really well. I would say that if you love your primary care doctor, and you would normally go to your primary care doctor anyway, if you had, let's say you had a weird spot on your arm and you thought maybe it might be cancerous and you wanted a doctor to take a look at it. Are you the kind that would go to your primary and have them look at it? If so, then a Medicare Advantage plan might work really well for you. But if you're the kind of person that would go on the internet and start doing research about your medical condition and the type of doctor you need to see and would be willing to travel to go see a doctor, then I'm not sure Medicare Advantage plan would work for you. I don't think you would be happy in a Medicare Advantage plan. You would want to find out if your current specialists are in the network for the plan that you're looking to get on. And that's something I help with. So don't stress out about wondering how you're going to figure that out. I got you covered there. But if you're okay with switching specialists, or if we can find all of your specialists currently in the medical group that you have available to you in the plan, then this might work really well for you. Sometimes I think you really have to think about how you manage your health care, right? Some of you might want to pick your specialists or maybe you get in to see your primary and he retires and you get pushed to another primary care provider and you decide you don't like them. You can change primary care providers on these HMO Medicare Advantage plans. That's not a problem. They do have caveats, right? If you called today to get your doctor changed, it wouldn't get changed until December 1st. So you would be stuck with the primary you have now through the end of November, and then you would have a new primary starting December 1st. Weird little rules like that, where there's a timing issue to switch doctors, but you can switch doctors. And even if your doctor sent you to a specialist and you didn't like that specialist and you want to get a second opinion, you just go back to your primary and ask them for a second opinion. They'll send you to somebody else for second opinion. No problems on these plans. Okay. If you have a desire to travel to see a specialist, this plan's not going to work for you. These plans are not built for people to see doctors outside of your home county. Okay. So if you have a hip doctor that you've been seeing in Stanford, California, and you want the ability to go back for a review or if anything else happens, these are not the plan for you at all, because you're not going to be able to do that. Now, if you're okay getting an evaluation with a new hip doctor in the town you live in, then you might be all right with this plan. Okay. What else can I tell you? If something about the what if scenario, right? You might be healthy today, but what if something happens? What if you come down with some dreaded disease? What if, right? If some of that bothers you, not having access to doctors wherever you thought you might want to go, I would not recommend a Medicare Advantage plan for you, because I believe that your peace of mind has value. Okay. Everybody's peace of mind and stress level has value, but it's different for everybody. So you have to decide what that is for you. Okay. So I will say that if you are on a limited income, and in fact, I'm going to tell you those dollar amounts now. If you are a single individual and your income is under $18,755, you qualify for Medi-Cal or Medicaid, right? That's the federal word. Medi-Cal is the California word for it. If your income as a couple, a married couple of two filing a joint income tax return, is below $25,268, you also qualify for Medi-Cal or Medicaid. If your income as a single individual is between the $18,700 and $25,700, you might qualify for something called a limited income subsidy. And if you are a married couple filing taxes jointly and your income is between $25,260 and $34,840, then you may also qualify for a limited income subsidy. And if that's the case, please message me, please email me, because we can get you qualified for that. And not only can you qualify for lower prescriptions, but if you qualify for Medicaid, your entire Part B will get paid back to you every month. The state of California, or whatever state you're in, will pay your Part B premium for you. If you qualify for low income subsidy, they won't pay your Part B, but they will give you much lower prescription drug costs. And you may qualify for food stamps too. So applying for food stamps, I oftentimes help my clients do that. All right, if you are interested in getting an appointment with me, I'm going to go ahead and type this into the chat box. And that way, all you have to do is click that link that I put in the chat box, and you can schedule yourself right on my calendar. If you're rewatching this over again, I'm going to include a link in the email down below for you to request a review with me. One of the things I will need is what's called a scope of appointment form signed by you. That's basically a permission slip for me to talk to you about these plans. I'm also going to need a list of all your current medications so that I can check and see and make sure that all of your medicines are covered under the formulary list under the Medicare Advantage Plan. I'm also going to need a list of all your doctors. Okay, that means all your doctors, your podiatrist, your ophthalmology doctor, your whoever you buy your glasses from, your sleep doctor, your cardio, right? All those doctors, your dermatologist, plus your primary doctor, and a list of the hospital you want access to, because you will be limited in the hospitals you can utilize under this plan. Now, one thing that I didn't go over before was the fact that these Medicare Advantage plans, they are going to cover you for emergencies anywhere you travel in the United States. So even though your regular care needs to be done in your home county, emergency is covered anywhere. They just charge you the same amount as if you were at home. And if you're at home and an ambulance picks you up and you have a true medical emergency, no matter what your home hospital is, they're going to take you to the nearest hospital. And then once you get stabilized, they're going to move you over to your contracted hospital. And it's all going to be the same cost as if you went to your home hospital that's contracted under the plan. All right, I'm going to open it up for questions. We've got a couple folks on the line. Any questions to ask me? I did not see any come through the chat today, but maybe you're thinking of some things now. If you want to, feel free to take yourself off of mute and go ahead and ask a question now. That would be great. Nobody? Alrighty then, I'm gonna go ahead. Oh, how do you unmute? Here, Angela, I just clicked a button. Maybe there you go.
I see it. I just was going to ask on these booking an appointment, you had talked about looking at our current plan versus our next year plan, what's changing, including coverages and premiums. Would I book a 30 or a 60? I don't want to take more of your time than we need.
I'm going to say you book a 60-minute appointment. Okay. Medicare has so many regulations and caveats and things that I have to tell you and explain to you and make sure that you understand. We absolutely need a full hour to go over everything so that you understand the plan completely.
Okay, thank you.
So don't worry about that. We need 1 hour.
Okay.
All righty. All right, folks, if there are no further questions, I'm going to go ahead and give you back your day. Thank you so much for joining me on the line today. If you know of anybody that needs help with their Medicare insurance plans, please send them my way. Medicare prevents me from making outbound phone calls to anybody. Even if you told me, please call my friend, she needs help. That's actually against the law for me to reach out to somebody. They have to approach me first. So feel free to give them my phone number, my email. They can email or text or share that link with them. They can schedule themselves right on my calendar, and I'm more than happy to take care of them. All right, guys, everybody have a great day. We'll see you next time.